Centuries of slavery, Jim Crow, and modern-day discrimination have led not only to mistreatment of people of color from the health community, but it's also led to mistrust. Today, we see it playing out when it comes to the COVID-19 vaccine. So joining us to take a look back at what happened, how it can be remedied moving forward, are Dr. Jeffrey Sterling of Simcoe Managed Preventative Care and Dr. Lisa Green from Family Christian Health Center, the first maternal child health and wellness center in the state of Illinois. Thanks so much for joining us, guys.
Greetings. Great to be with you.
Thank you for having us.
Well, this is something that needs to be talked about so much. And this past year, it has really been unearthed, the disparities in health as far as people of color are concerned. Let's get started by asking how exactly we got here. And jump in.
All right. So Family Christian Health Center is located in the far southern suburbs of Chicago. And what we began to realize in the area is as Chicago began to dismantle its housing projects and things like that, and people were moved out, when people were moved out, what did not come necessarily was resources to allow them to be able to thrive and get to what that next step looked like for them. And so when you look at a lot of our communities, they have been under-resourced, whether it's education, whether it's access to food, whether it's access to jobs and unemployment. All of that sets the stage for a landscape that allows people to not thrive at what we consider the American dream. And so this happened all across the country prior to COVID. COVID just took the umbrella off what existed, meaning that when you look the children in certain areas, that the opportunities for them, for even if it's an after-school program, jobs, things like that within the area were limited. Families who had limited access to certain groceries. So whether I want to eat organic and eat fresh foods, every neighborhood doesn't have a Whole Foods. Every neighborhood doesn't have a Mariano's. So I have to make the best choices with what I'm equipped and have exposure to. And so COVID brought about the ability to really be able to fight and build my immune system. But I can only fight and build up with the area that I live in. And so that really has put together to the forefront how these inequities that have existed for years were really just highlighted because of COVID.
Well, Dr. Sterling, it's highlighted, yes, but how do we change that?
Well, you have to acknowledge the fact that we got here by design. I don't know that health equity has ever been an aspiration in this country, in as much as access to care, quality of care, and cost of care remain social determinants, social influences of health. Given that Black and other diversity communities have been the victims of healthcare disparities, it shouldn't come as a surprise. This is a very disheartening and frustrating conversation because there have been those of us who represent and serve these communities forever that have been attempting to bring these issues to light. So there's a fundamental need to say this stops now and we want to begin anew. And even doing that isn't enough because you can't say today we're going to start with equity. There's a hole that needs to be dug out of in order to level the playing fields. So the types of things that represent best practices in public health and medical care need to start with, as always, health prevention and health promotion, and not just waiting until a stressor like COVID-19 comes around and then you're focusing on sick care. There needs to be a reimagining of the way that healthcare is delivered across America, and certainly with the disparities that exist in the city of Chicago and the state of Illinois. We have to fundamentally rebuild this thing.
And not to mention the medical deserts that are around there. The hospitals, there are no hospitals in these communities, and those hospitals that are there are understaffed. They're not getting the same thing that other hospitals are getting. And now Mercy Hospital, it's been on the brink of closing for so long. We've recognized the problem. How will we dig out of it, as Dr. Sterling says? How do we dig out of this hole that we have been in for so long? We do have new administration. Is that where we start? Or, what do we do?
Well, I think you have to look at it as I use the word frequently, an ecosystem. There is not one fix, and we have to begin to break silos. So once we can begin to come together, and recognize that the problem exists. That's the first step in the solution. And we have to realize that health starts not when you're in the hospital and diagnosed.
Right.
It starts when you're in grammar school. It starts when you're in high school. It is that early on family network that needs to be developed so that they have access to those things that make them healthy. And what do I mean by
Right.
that? When we talk about food, for example, years ago, African Americans basically a certain diet was our tradition, right? But as African Americans moved and came north, that changed. And so we weren't doing jobs that required us to be able to, we were working outside most of the day. And so most of our jobs have become stationary. So the importance of exercise and really being able to realize that that plays a factor. And so when you talk about exercise, well, I have to have a safe environment to do that, but I have to actually understand why that is important. And so if I get the why to that, people will rise to the level that you set for them. But we have to make a decision that is worth the investment to educate people to make sure that they have the information that they need. Exercise is the one component. Then the second thing is food. Because if I don't know or have access to food, exercise, or where I'm going to live, those all factors play a key role. So when you talk about creating this ecosystem and environment, then that impacts the teachers, that impacts policymakers, that impacts insurance companies, that impacts the community investors that are interested in making sure that these communities are sustainable, not where they're equipped for a handout, but a hand up to be able to let them survive and thrive in the environments that they live in.
Yeah, Dr. Sterling, this sounds like the perfect storm.
Well, look, the bottom line is that even if you try to equilibrate access to care, cost of care, and quality of care, that isn't going to get it done because, people visit their physicians, once a year, twice a year, unless you're going to the emergency department.
Right, or unless you're sick. Unless you're sick. There's no preventative.
Unless you're sick, exactly.
Yeah.
Exactly, and that continues to be the point. We have to empower individuals to be better stewards of their own care, give them the tools necessary to learn how to manage their own care. And as always, it starts with health prevention and health promotion. We have got to learn how to stay ready so we don't have to get ready. Prioritizing health in the world of healthcare, more so than medical care, we talk about preventive care instead of curative care, is the way to let people know, as was mentioned by Dr. Green, you have to start talking about reducing stress. You have to talk about elimination of food deserts. You have to talk about how to become your partner with your physician or in some other way, be your own purveyor of your care. So there's so much, but fundamentally, we have to learn to take care of ourselves as a fundamental part of this conversation as we advocate for the things on the outside that level the playing field with everyone.
Sounds like you're saying it starts with us. Answer this question. Would more physicians of color help?
Oh, absolutely. Studies have proven that people of color represented by people of color who understand some of the other social and dynamics that families go through allow for an easier access of communication. There's so few African-American doctors, in our community. And so when you have people that look like you, that understand where you've come from, that understand just the culture, it allows, as Dr. Sterling was talking about, that playing field, because then we can speak the same language. When we can speak the same language, then that way we can begin to, I can respect your view, you can respect mine, we come in the middle, and then how do we get you from where you are to where you need to be?
And Dr. Sterling, I'm sorry, go ahead, Dr. Sterling.
I just want to make a quick point. The public health data has long demonstrated that if we're having a conversation about healthcare outcomes, simply put, healthcare outcomes are optimized when you're receiving them from individuals who are culturally sensitive and specific. That means in the example of the Black community, Black physicians actually take better care of Black patients. And if you look at the data, when you have in medical school enrolled right now, the equivalent of 10 physicians for every state in the union, that's nowhere near enough to be able to provide the culturally sensitive levels of care that are needed across the country.
Let's talk quickly about the vaccine. Tell us, is the vaccine safe? Because we know from the Tuskegee experiment, Lax experiment, is this vaccine okay to take?
Jeff, I'll let you, Dr. Sterling, you can start and then I'll chime in.
We have got to not allow our reasonable concerns become irrational fears. We're at the point now to where we have multiple options that are about 95% effective. With all due respect, absolutely, we and individuals like us, we are going to be the wall to make sure that we aren't being disadvantaged in the way that happened with some of the historic trials and tribulations that African Americans have been put through. But today, we cannot allow ourselves to spend so much time on theoretical considerations that we miss our place in line for the solution that's right there in front of us. There are two things we need to know about. One is that these vaccines actually work. There are wonderful slides that actually show the plummeting of deaths that occur within the 14-day period after people receive their final dose of this vaccine. The data is in. But the flip side, again, is not just the curative strategies. We have 96% success. If I'm double masked and the person in front of me is double masked, we have the tools that are necessary to protect ourselves. So if you want to get the vaccine, yes, it's safe. If you don't want to get the vaccine, at least have the tools and know how to take care of yourself. We can beat this.
Quickly, Dr. Green, we've got 30 seconds.
I think the biggest thing is seeking information from community partners or people that you trust to help make the decision. Don't let social media make the decision of something that you saw on Facebook or something on Instagram. I think what happens is people's fears and sometimes their perception can be their reality. But we have an opportunity now to change that. How do we take the fear and make them reality?
Thank you both so very much. You can find Dr. Sterling and more info on his preventative care efforts at simcoeillinois.com. And for more information on the Family Christian Health Center in Harvey, visit familychc.com. Thank you both so very much.